one or the other. So if we do a Caldwell, are we going to angle our tube?
Yes.
No. Not for sinuses. For skull we do, but we still want that 15-degree angulation. We're going to angle our tube, or we're going to put a sponge on the forehead that's about a 15-degree angulation to bring the forehead away, and that'll compensate for that angulation. Okay?
Yeah.
All right, but generally, most facilities will just go ahead and do a straight PA. But remember that for sinuses, you don't want to angle your tube because you want a what kind of beam? Horizontal beam to demonstrate what? Perfect. Okay, so everybody think they have that one? Okay, now what about a lateral? Which side will we do?
Yeah,
Or left.
Affected side. Now you notice on our skull we had them all lengthwise except for the lateral where we changed it. Do we have to do that for sinuses? No, because we don't have to get the back of the skull, correct? So let's do this as quickly as we can because I'm sweating like a pig. So we change our cassette, very important. Make sure you adjust your control panel. All right, so we want our patient kind of obliqued, right? And we want them to go ahead and look at me. And you can just tell them, verbalize, look straight at me, and then put your cheek against there. We want to make sure the mid-sagittal plane is what? Parallel with your image receptor. And I think in the book it says something like the mid-sagittal plane. As you bring the cassette out, they should hit perpendicularly or something like that. But mid-sagittal plane parallel with your image receptor, interpupillary line, perpendicular. Where do we want our central ray?
2 inches above the
EAM.
Above the EAM, correct? Okay, so are we above the EAM?
Nope.
No.
It's not
It is now.
Let's move her back just a little bit. Because we want to make sure that we get the frontal sinuses, correct? So what does it say in your book as far as centering? Is it just 2 inches above, or is it?
It's also interior, isn't it?
It's in between what, the outer canthus and the EAM and superior.
Yeah.
Okay? So just use good common sense that, you know, when you're actually doing this, you want to look. So let me make a point here. Say the book said this, and you're like, I positioned it correctly, right what the book said, but it cut out the frontal sinuses. What do we have to do? Use critical thinking, right? So I can look at this and say, I know those frontal sinuses are going to be cut off, so I need to have our patient move back just a little bit. About right there. So it's going to be superior to the EAM and in between the outer canthus and the EAM. Okay? And we want to make sure we don't have any rotation or tilt, correct? Yeah, tilt your head that way a little bit there. A little too much back. And then in that way. Or too much a little back. There you go. And you can just, you know, give little hand signals. You don't always have to touch their face because they might not want you. I don't like people touching my face. I really don't. Tell me how you want me to move, you know? Okay, you want to make sure that you have the correct marker down. Which one would this be?
Left.
Left. You want to make sure you bring your shielding in. Now, if you have somebody that's shaky, you can have them not hold here on this T handle, but put their hands up against the upright bucky, right? Everybody good? Okay, go ahead and relax. So a PA Caldwell, one of the two, usually not both. A lateral, a Waters. Have we done the Waters yet?
Nope.
Okay, so let's go ahead and do the Waters. If I was